Good morning, colleagues. Today, we'll focus on an important complication in the management of traumatic brain injury, which is ventilator-associated pneumonia, or VAP. Recent systematic reviews and meta-analysis have highlighted key risk factors and outcomes of VAP in this vulnerable patient group. Let's walk through these findings. Ventilator-associated pneumonia remains one of the most frequent ICU complications in patients with traumatic brain injury, prolonged ventilation, altered consciousness, and invasive interventions increase the risk. This review synthesized data from 12 studies totaling 2,883 patients to clarify which factors are most strongly linked with VAP and how it impacts outcomes. The risk factors noted are 1. Male sex, which has a 58% higher risk of developing VAP compared to women. 2. Injury severity. A head-abbreviated injury score of more than 3 nearly tripled the risk. 3. Blood transfusion. On admission, doubles the likelihood of VAP. And lastly, barbiturate infusion, often used in refractory intracranial hypertension, was associated with a 3-fold increase in VAP risk. On the flip side, 2 factors appeared protective. Firstly, is prophylactic antibiotic use, which reduces the risk about a third, in keeping with the Brain Trauma Foundation Level 2 guidelines, and younger age, with every few years younger lowering the risk modestly. And outcomes. So what happens when TBI patients develop VAP? The consequences are significant. ICU stay was prolonged by an average of 7 days. Mechanical ventilation was extended by nearly 6 days. Hospital length of stay increased by almost 12 days. And these findings translate into higher healthcare costs, increased morbidity, and delayed rehabilitation. So what do these findings mean for us in clinical practice? Firstly, we need to be particularly vigilant in male patients with severe head injuries, especially those receiving blood transfusions or barbiturates. Then, where possible, we minimize transfusion exposure using barbiturates judiciously and implement strict ventilator care bundles. The evidence suggests that prophylactic antibiotics may play a protective role, though this remains controversial and must be balanced against antimicrobial stewardship practices. So in conclusion, ventilator-associated pneumonia in TBI patients is not only common, but also clinically impactful. By identifying patients at greater risk, we can tailor preventative strategies, optimize ICU care, and potentially shorten recovery trajectories. Continued vigilance and targeted interventions remain essential in reducing this burden. Thank you. This synthesis reminds us that in neurocritical care, preventing secondary complications like VAP is just as crucial as treating the primary brain injury. Thank you for listening and have a blessed day.